There are two types of environments where we see long-term care services being offered. The first one of those is our community-based long-term care services. There's four main goals behind community-based long-term care, and the first one of those, and the overarching goal of community-based long-term care, is to provide long-term care services in the most economical and least restrictive setting that we can for our patients. So going back to the overall goal of long-term care services in the long-term care setting, which is promoting functional independence for our patients. We also, in community-based long-term care services, act as a supplement for informal caregiving, and we work to provide respite care for family members who may be working as the primary caregiver for the patient. One of the other main goals of community-based long-term care is to work to delay or even try to prevent institutionalization of the patient. Now, within the community-based setting, there are four main sections where we'll find services being offered. That's going to be home health, adult daycare, adult foster care, senior centers, and then case management. Now, the home health setting is one that most people are probably the most familiar with. In the home health setting, we see Medicare as our largest payer source here, so we do have a lot of patients that are on Medicare. Now, it's important to understand that if you are a Medicare patient and you need home health services, there are a couple qualifiers that you must meet in order to receive those services. The first one is that you must be homebound to your home, that you require services being provided in your home. The second one is that you have a plan of treatment that is reviewed periodically every so often by your physician, that they're keeping that up to date and that you are staying on track with your plan of care. You also have to have intermittent or part-time skilled nursing and some type of rehabilitation component. So this is where we're going to see our home health nurses come in to help our patients with their ADLs, their IADLs, get them functioning and making sure that they maintain that level of independence. Now, our second type of community-based long-term care services is our adult daycare, and it is exactly what it sounds like. It was designed and set up for people who live with their families, and those families may work and need some type of partial respite care for those patients that need long-term care services. So it is a daytime community-based program, and it really focuses on prevention and health maintenance. So there is some supplementation of nursing care, maybe some psychosocial therapies that are offered, and different types of rehabilitation in this setting. Now, similar to adult daycares, we have adult foster cares. Now, these are generally smaller. They're family-run homes that care for non-related adults. So they function just like you would normally think a foster home would function, but these are for older adults who may need long-term care services that don't have a family around that can help them. So in the adult foster care setting, we have room and board, some overnight stay, and personal care. But it's important to note here that to maintain this family environment and the family feeling that's supposed to come with adult foster care, most states, not all, but most states across the country will license fewer than 10 beds per family unit in adult foster care. Senior centers are starting to become more common, and we're starting to see more of them around. Senior centers, think of those more of just like your local community centers. These are for older adults who just want to get together, congregate, socialize, catch up with each other. Some senior centers may offer a noon meal or lunch or dinner, and most of the senior centers do offer some type of health screening or wellness program. Some have workout rooms, gyms, different types of games you can play. They offer monthly book clubs, just a way to keep that quality of life when you're talking about your mental well-being, your social well-being, your spiritual well-being. Senior centers really try to work on that holistic approach to your care when you're in long-term care services. Now, just as it functions in a hospital, case management in long-term care really works to try to link and manage and coordinate services to meet those different and challenging needs of our elderly clients. So we often use case management when an elderly client may have family, but they live a far distance away and cannot work to coordinate these services themselves, or they may need help coordinating these services because remember, again, our healthcare delivery system can be very confusing to navigate. So case management will help with working on your assessment and your care plan. They will help identify the appropriate services you need based on that care plan. They'll determine different programs that you may be eligible for, like Meals on Wheels, different community-based programs such as that. They'll also work to make different types of referrals to different types of physicians that you may need to see or different types of specialties that you may need. And they'll overall work on coordinating your care and your financing to ensure that you receive the services that you need. Now, aside from the community-based environment setting for long-term care, the other setting that we'll find long-term care services being offered in is your institutional long-term care settings. So in institutional long-term care settings, these different types of services are set up for patients who may not adequately have their needs met in more of the community-based settings. They may need a little bit more intensive treatment and a little bit more specialized care. Now there's 6 types of institutional long-term care settings that we'll focus in on, and those are going to be our retirement facilities, our personal care facilities, assisted living facilities, our SNF or our skilled nursing facilities, maybe subacute facilities, and more of our specialized facilities. So let's first talk about our retirement facilities. Now, even though retirement facilities do not offer nursing care services, they do have a very large emphasis on privacy, patient security, their independence, and making sure that they maintain an overall active lifestyle, going back to, again, to that overall goal of long-term care itself, which is helping a patient to maintain their functional independence. Now within retirement facilities, we're going to see different types of organized programs to help with that social health. Remember our holistic approach to long-term care. We want to make sure that they're maintaining a social life, that they're being socially active. So they're going to in retirement facilities have programs like physical fitness. You're going to see recreation, shopping, entertainment, and just overall and general socializing events. And some of these retirement facilities even offer types of hotel services. So think about coming in to clean your room, things like that. Now in personal care facilities, just a little bit different than retirement facilities. In personal care facilities, we're going to have non-medical custodial care that's going to offer some basic assistance in a protected environment for our patients. Now in assisted living facilities, just what it sounds like, you can almost guess, you just need some help. You need some assistance with more of these activities of daily living or our ADLs. So in this type of residential setting, we're going to have personal care services that offer some type of 24-hour supervision to just help our patients with more of the ADLs that they need. So we're going to have scheduled and maybe sometime unscheduled assistance with our ADLs. They're going to have social activities, but we are going to incorporate some type of nursing care services within the assisted living facility environment, and they will help patients with their medications, making sure that they're taking the correct medications at the correct time of the day. Now our SNF or our skilled nursing facilities, they are going to offer a wide array of long-term care settings. They're going to be medically oriented and have care provided by a licensed nurse in this setting, and you are going to have a plan of treatment that is going to be authorized by your physician. So you do have your ADLs, and those are going to be delivered by different types of therapists and paraprofessionals. So you're going to have things like therapeutic diets, nutrition supplements, rehab. These are all going to be components of skilled nursing facilities. The patient's treatment plan in a SNF unit or a skilled nursing facility unit is going to be highly individualized, and it's going to be based on their individual assessments. So what are they able to accomplish on their own, and what are they not able to accomplish? So in a subacute facility, we can think of this more as like a blend of intensive medical care provided with nursing care and other services that may be a little more technically complex. We're going to see subacute being offered by three different avenues. We can see them offered in long-term care hospitals or LTCHs. We may see them in skilled nursing units or SNF units, and we may see home health come in to provide certain services overall. Now, subacutes are the cheaper alternative to the hospital stay, so if we can get our patient into a subacute facility for care, that is going to be the cheaper alternative than having to put them in an inpatient stay in a hospital to receive some of these services. Our last type of institutionalized LTC care is going to be our specialized care, and it's just what it sounds like. You have some specialty that you need some type of assistance with. So we're going to find patients here that have ventilators that they need cared for, maybe some type of wound care. So you've been discharged from the hospital, but you have an open wound. We would send a home health wound nurse to your home. Alzheimer's patients may be in specialized care, along with those that have some type of intensive rehab that they need. We'll see closed head traumas in specialized care, as well as patients who may have different types of diseases like HIV and AIDS. So overall, two types of environments where we're going to see long-term care services being offered. We can see that being offered in our community-based setting or in our institutionalized setting. And it really depends on what circumstance the patient finds themselves in. Remember, there's three types of circumstances that's going to dictate the need for long-term care services. That a patient has some type of cognitive impairment, whether that be physical or mental, that will really limit their ability to do those activities of daily living, those ADLs. They need some type of continuity of care after they've been discharged from the hospital, or they just need care in general in a more specialized environment.